is written and verbal instructions. So like you're presented it visually, and then you're also told it at the same time. So
Got
I
it.
always recommend that for anybody in general, but even more so for those who are
Yeah.
neurodiverse.
Really cool. Okay, I want to ask, this is maybe backtracking a little bit, but I feel like it's really, really important because I have seen so much more individuals maybe like self-diagnosing.
Yes.
And I'm curious what your thoughts are if somebody thinks that they are, neurodiverse in some way, shape, or form. How do they go about, seeing if they are? Are there any risks in self-diagnosing? I just kind of want to dive into that whole topic.
Ooh, very touchy subject. I'm glad you actually brought that up because I
Yeah,
know you and I have talked a little bit about this and how
yeah,
controversial it's become.
right.
So twofold. The first is I get it. Social media has allowed so many doors to open and people becoming more aware. And I think it's made a huge step forward in like mental health awareness and understanding. I
Yeah,
absolutely love that. The scary part is when you only use what you see on social media or on Google. Dr. Google is what I'd say. That is not a safe way to diagnose yourself.
yeah,
You can Sure, you might want to identify that way because you want to better understand who you are, but
yeah,
you shouldn't be labeling yourself with such a strong kind of mental health diagnoses without actually having a professional lay eyes on you. And what I mean by professional is not necessarily if you're a kid, your kid's pediatrician, because there's so much nuance in mental health. Poor
yeah,
pediatricians only get 7 minutes at times to be with a patient,
yeah,
with a kid. They can't possibly, and they see you once a year for a well child check, they can't possibly know all the nuances. You can't
right.
expect them to, and you can't blame them to either.
Yeah,
And also that's the same goes for like just seeing things on Google or with your other doctors. Like I had one who asked me, well, my GI doctor sees me all the time, but why didn't they say anything? Well, GI doctors, that's not their specialty. Everybody has a specialty and there's a reason for it.
yeah,
And so it's really important that you go to the right people for diagnoses and for, well, not even a diagnosis, but just to get the clarity, the clarification.
yeah,
So those who can diagnose mental health disorders are psychologists, clinical psychologists, as well as psychiatrists. What you would want though is like basically like a good solid clinical interview. So not just asking about like right now you're gaming and you can't stay focused, you can't pay attention. Oh, you probably have ADHD. No, you have to, ADHD is defined and diagnosed by those symptoms have to onset before age 12. So that
mhm,
means you have to kind of talk about early childhood history. You need to rule
yeah,
out if there was any trauma. There's a
yeah,
lot of nuances. And so it's really important that you get somebody who's an expert who asks those questions. There's also gold standard evaluations. So for autism, there's autism diagnostic observation schedule.
yeah,
For ADHD, there's a lot of good, like solid screeners and attention kind of measures.
yeah,
So the caveat is, I get it. It's really costly sometimes and really pricey.
yeah,
Yeah. And so oftentimes it's like try to find your local kind of academic institution because they sometimes have research studies.
mm,
Talk to your ongoing therapist that you have to see if they have anybody that they're good friends with that can do the diagnosis properly, especially when you're an adult. You've lived so much of your life. You, as an adult, you can't possibly just diagnose yourself off of this one period of your life.
yeah,
Um, and oftentimes, if you made it all the way to adulthood without a diagnosis, you probably were doing pretty solid. And then now the mask has come off, or there's become like a big traumatic event. And that's what kind of led you down this route. And so you really want to make sure you figure it out.
yeah,
The scary part of self-diagnosing or
yeah,
using social media and the internet to diagnose yourself is then you present to somebody who can prescribe medication. And you're like, look, I can't stay focused. I am just like, I don't finish tasks. I feel like I'm super impulsive. And then somebody will slap a label on you and it's like, oh, you've got ADHD. Here's a stimulant. That's
mm,
actually really not great for the health and well-being of our bodies because if you don't have ADHD, your brain will get used to those things. And also it ends up not solving any of the problems that you might actually be facing.
right.
Depression, trauma, they all look like ADHD. Fatigue in general, anxiety that's like really undiagnosed or untreated. Yeah, you can look like you're not paying attention.
Right. So if you're self-diagnosing or using the means that you have to try and figure out what's going on, what I'm hearing is like one of the big risks of that is then you end up getting help that isn't the actual help that you need. And maybe
Correct.
searching for strategies that aren't actually going to help you. So in this kind of idea of just being cautious around diagnosing and social media is really in the long run for the better
For
of
you,
you.
for your financially, for your wallet, because you're not going to be paying, do not be paying things that like aren't evidence based. That's one thing, right? Everybody
Yeah,
talk about money and things like
right.
that. Like
Yes.
for your financial well-being, but also for your just overall like physical well-being. You don't want to be putting stuff in your body that doesn't make sense.
Yeah.
And then also just for your own stability, like there's different types of evidence-based modalities for different diagnoses. And if you end up having trauma, but you end up doing narrative talk therapy, well, that might actually be more detrimental to your trauma. If you've got autism, oftentimes you're trying to do classic talk therapy. That does not work for those on the spectrum
Right.
because they don't have the ability to, they just get frustrated. Why I can't tell you why I'm angry. I can't tell you why I'm mad. I don't get it.
Yeah.
And so that actually turns them away from therapy, and it ends up being harder in the long run to get them to even want to start therapy again when they have the right therapist.
Yeah. Yeah. That's really fair. Thank you so much for speaking on that. That's like definitely been on my mind.
I know this is constantly something that I've been thinking about and worrying about. And I'm not trying to dismiss people who are, financially, that's the only way they
Totally.
can do it.
Totally.
But it's like, just double check with an actual human being.
Yeah. Yeah. It sounds like just double check your sources and get in tune with the people that can actually help.
Yes.
Uh
Yeah. And
Dicey.
And one plug that I just want to say is like
Yeah.
oftentimes the snippets that we see on social media. So like the TikToks, them being only 10 seconds or that 30 seconds on Instagram videos. They're
Yeah.
like, well, if you can't finish what you started or you are often walking around and forgetting what you're supposed to do, it's like that might mean you have ADHD. It's like, no, that's definitely not the diagnostic criteria for that.
Yeah, absolutely. Because I mean, hi, me literally all day. I have not been able to finish a single thing that I've started. And honestly, it's because the sun isn't out. And if the sun's not out, I can't make myself do things.
Totally fair. I used to live in London, and so it used to be overcast all the time.
I would, oh my God, I would lose my mind. I just wouldn't work. Anywho, okay. So what last kind of piece of advice or nugget that you want to put out there for individuals that are either neurodivergent themselves, that are looking for support, that are caregivers? What do you want to say?
Ask for help, ask for clarification. Don't be afraid to question it. I saw this. Can you just double check this for me? Like, what do you think?
Yeah.
But don't be so hard fact. I think a lot of individuals right now are going in already labeling themselves with that instead of asking the questions like, I have this symptom and this symptom, like, what should I be worried about? So like more open-ended questions, I think is kind of, if I have to leave off on anything, it would be that. Ask
Yeah.
more open-ended questions and less matter of fact.
Love it. It sounds like moral of the story is stay curious.
Take your, that's exactly what I was thinking.
I love it. Beautiful. Well, if people want to learn more and people want to find you, how do they find you?
Yes, absolutely. So you can follow me on Instagram, Dr. Courtney Kwan. And then I also practice in a private practice group it's called Therapy Lab. And so you can visit that and Google it online.
Nice. Awesome. Yay. Thank you so much for all your wisdom and your joy. Really, really appreciate it. It was super enlightening today. So thank you.
Thank you so much for having me. And I love your products. So I'm really excited to be able to use them as like a concrete visual tool.
Oh, thank you so much. We're really glad that we get to provide something that helps. So, yay. Cool.